My name is Neel Vyas, and I am an obstetrician and gynecologist at Houston Methodist Hospital. And I've been there for the last 6 years, but I've been a practicing OB/GYN for probably about 18 years now.
My name is Neel Vyas. Lived in Houston for about 24 years, but pretty much a Texas native. I work for Chevron. Worked for Chevron for about 17 years. I work in kind of innovation technology and emerging technologies.
Neel is 13 years old, and my daughter is 11 years old. And when Neel was 7, he got struck by some kind of an illness. We still don't know exactly what it was, but he was a healthy, perfectly normal, very neurotypical 7-year-old. We went to Hawaii, and I don't know if he caught something there, but we came back, and actually during Hurricane Harvey, we went up to Plano just to kind of get away from all of the flooding. And he was a little sick one night, or one day, I guess he was sick, and I actually took him to my sister-in-law's pediatrician, and he said, "Oh, he just has the flu. He'll probably be fine." And I remember that the night that all of this started, I had this really burning desire to get back to Houston, even though Harvey was still the flooding was still happening. It wasn't raining anymore, but people were still recovering. But I had this terrible desire, I had to get back to Houston for some reason. And that night, as I was thinking about this, my husband called out, and my husband and my kids were upstairs in the bed, and he's yelling for me, and I run upstairs, and he's like, "I think Neel had a seizure." And that sort of was the start of our journey. I remember running down the stairs. We went to the emergency room. We were in the emergency room, and he had another seizure there just as they were going to discharge us. And then he just never woke up for 2 months. He just was in a coma. We got life flighted back to Texas Children's Hospital. And in retrospect, I always think that it was my intuition telling me that something was wrong. I had to get back to my home base. It was like our entire life changed in the blink of an eye. We thought, all right, it'll take maybe a year, maybe 2 years until he's ready until this all goes away, right? We still had all this hope that it would all go away. But now we're on year 7, and it hasn't gone away. And we've tried 20 different medications, and he's had multiple surgeries.
The seizures are very scary every single time. You never get used to them. Even as I've seen him seize probably 500 times, and I'm never oh, there's another seizure, and very calm about it. It's really jarring. I had a friend who was a patent attorney, and I called him for an unrelated item, and he knows the struggles we've had with Neel over the past 6 years. Everybody in our friend circle and social circle knows. And I was like, we're really struggling. And he's like, "Have you considered stem cells?" And we had just given it a cursory look. But then he made the connection, reach out to Hope Biosciences and Donna. They're doing some really amazing stuff. We did some more due diligence with other physicians. My wife's a physician. And we heard tremendously rave reviews about what Hope had been doing, and kind of revolutionary. And just thought that was an incredible opportunity, right down the street from us as well.
So that's good to know, because we actually received FDA approval.
Congratulations! You don't even know. I gotta leave. I'm so sorry. Dressed all day long. Oh my god.
Well, we're so excited. We're so excited for you. We're so glad. We're so happy.
Thank you guys so much for everything that you've done. You don't know how much this means to us.
It was incredible. One of the happiest moments I can remember in a long time.
When you're a mom, and when you're a mom, really, not even a physician, when you're a mom, you're just kind of constantly looking to get your life back, your son back.
Being a normal kid, riding his bike, he used to love to ride his bike. He hasn't done that in 6 years.
Yes, I mean, Neel is sort of first in class, right? This is experimental. And the big thing is that if it does help Neel, it can actually open up a huge potential opportunity for other kids, right? Because it's not just about him, it's about everyone who comes after him. So I am, of course, very hopeful that this is going to help him, because if it helps him, there are hundreds, thousands of kids like him that it could help.
That brought back a lot of really vivid memories. But starting off, Donna, like, you told us to come. It was supposed to be a small luncheon. We're going to say some words. Now we're following Miss Kathy and Dr. Ed Young and giving our piece. We're thankful for the break that you guys had a chance to eat. We're really very fortunate and thankful to be here. I wrote a few things down so we can kind of just make sure I don't miss anything. It seems like Hope, they're definitely on the forefront of something huge. Like, I work in technology and innovation, and they're doing something that's best in class, and I'm very thankful for that. But what you don't also see right off the bat is their care and compassion as human beings, right? The technology is first in class. We see that. They've demonstrated it. But we're so thankful in terms of their approach, in terms of how they've handled, taking care of Neel and the rest of us as a family. Like my wife was saying, Neel was born healthy. And, as parents, we simply, our lives just became revolved around, our son and our daughter. And what happened was an illness that was just so abrupt, sudden, and devastating. And he went from a fully healthy kid to what felt like being in a coma in a respirator in a blink of an eye. And that is something that, we still, have probably PTSD associated with it. And, as we mentioned, we've tried so many therapies, drugs, surgeries, potentially more surgeries. And, we saw a lot of really top physicians that are really caring towards Neel, but they throw around words like, lobectomy, hemispherectomy, let's cut a resection. Like, these are words that you never really want to hear about your child's brain. So, we were looking at all sorts of options, very desperate. And, that's where kind of the stem cell piece came in. We're super excited. I think the caliber of the stem cells that are, being developed here are huge. What you guys have done is simply amazing. We'd also like to really thank all the generosity of the folks that are here in terms of the Compassionate Use Fund. We would not be having this opportunity without your dedication and support. It means the world to Neel, and also the implications associated with these treatments are so vast beyond Neel. We're so excited about the potential of what this could bring to so many others. So thank you for being here. I'm going to bring it over here.
I just want to echo everything that my husband said, but obviously the opportunity for Neel to receive these stem cells and all of the generosity of everyone who's donated to the Compassionate Fund, it's not lost on us. And the other thing I want to add is that, as a physician and as a mom, stem cells are something that in the physician community are not always looked upon as the panacea. They're actually sometimes looked upon negatively. But the truth is that if you seek out a good foundation or a good place like Hope Biosciences, what they're doing here, the type of stem cells that they're cultivating are far and above, beyond anything that every Tom, Dick, and Harry is trying to peddle down the street. And that's really important. I would never, ever put anything in my son that I thought was going to harm him or not help him. And I have a lot of hope that these stem cells are going to heal my son, and it's going to change our family. And it's going to give me my family back, and it's going to give other people their families back. What you saw in that video, you see Neel, he's looks like a normal 13-year-old, but that's not what he looks like every day. There are many days when he looks terrible. We didn't, show you his seizures, but they're not fun. So I wasn't going to speak that much just because I get so nervous and I get so emotional. But again, I really do want to say that I'm so thankful for this opportunity. It's not lost on us. And Hope itself has created a type of stem cell that is just amazing. And that's it. Thank you so much.